right, here we go, everybody. So let me get things set up here. There we go. Give it a little bit of time, see all who might join on before we dive in. When you join, just give a hi. Give it a few minutes, let people get on. Hope everybody has been staying well in this heat. You know, it got pretty muggy yesterday and today again. That was one thing that was beautiful about South Dakota. There is not the same humidity, so the heat feels okay there. It's not too bad. But it was good to get back home in Indiana. Probably kind of dive into the chat maybe about 5 minutes after, just to give people a little bit of time. If you hear birds, that's not real birds. It's just some bird song, relaxing, whatnot, to kind of drown out the hallway noise a little bit. So hopefully it's not distracting for you. If it is, just let me know. That in the office a lot of times, and folks would be like, where are the birds? Am I going crazy? No, you're not going crazy. There's bird sounds. So I'll give it just a few more minutes, let some others join. But if you're joining after the live is done, please feel free, drop some comments, questions, let me know. Like I said, today's chat is really just to talk about direct primary care in general. So we're going to be kind of just going through some basics about what direct primary care is, and hopefully get some questions answered that folks may have about that. All right, give it just a couple more minutes, see if there's anybody else that's got time to pop on. I know everybody's clock might not be exactly the same. I've got 12:02, so I'll give it a little bit longer. I see a couple people have hopped on. Feel free to say hi, let me know who's here. Let me know what you're up to. Hopefully you're not driving in a car, maybe sitting enjoying lunch somewhere. All right, we're almost to go time. Got some people joined in. Nobody's identifying themselves. Everyone's wanting to stay incognito. That's okay. I did put the rewind feature on, so hopefully, you know, if you're starting midway on this, it will let you kind of rewind back, or again, you can always rewatch it later after we're done to catch anything you may have missed from the beginning if, you know, we're starting and you've missed some. But okay, we are gonna go ahead and dive in. So like I said, this is just gonna be a general chat about direct primary care. Not anything specific to what I'm doing. I'm going to be posting all that out in a different way and getting you guys that information, but really just wanted to take a little bit of time to talk about direct primary care, because most people have never heard of that or may confuse it with other things. So just wanted to talk about it a little bit on its own, just to clarify, answer any questions, that sort of thing. So really appreciate you guys joining or listening in later to learn about this a little bit more. Okay, so DPCs are all unique. So if you have seen one DPC, or maybe if you have seen a direct primary care clinic, that's what DPC is. Sometimes I just say that instead of the full thing. So if you hear me say DPC, that stands for direct primary care. They're all different. They're all unique, which is great. because they can all be adapted for whatever your needs might be, whatever that physician's preferences are. So it really allows a lot of adaptability for patient and physician to establish whatever is needful. But that also means that there's a lot of different ways that business can be done in a direct primary care clinic. There's a lot of things I'm still learning about direct primary care, so if you have a question that I don't have an exact answer to, I will write them down and we can get back to you with those answers. I will probably direct message you back about that if I'm able to do that, and then I'll also put that answer in the chat for this live so that if other folks also had that question, they can see that answer there as well. So please give me your questions, but like I said, if I don't know the answer, we'll find the answer. So that's a good thing to make sure I have a pen. Okay. All right, so the basics of direct primary care, if I'm looking off screen, it's because I'm referencing my notes. I want to make sure I don't forget anything. But bottom line, direct primary care is no insurance for primary care services. So not at all. You're directly paying your physician for their services. So what that means is very clear billing, right? You know exactly what you're paying. You know what's covered under that. So you don't have to worry about if your physician in your direct primary care clinic is in network or not. They are, they can see you. They don't take insurances, so it doesn't matter what insurance you have, you can be seen by them. It's really also a stripped down clinical model. So instead of having all of these administrative layers to handle everything that needs to be done for insurance billing, all of their check boxes that they want to have done that need doing, we don't have to worry about doing those. So we're able to strip away a lot of those administrative layers, which decreases overhead costs for the clinic because that's less people that we're having to pay to handle all of this. It also means that there are fewer people between you and your physician. So there's not the middleman of insurance, less administrative layers, less people between you and you actually getting to talk with, interact with your physician. So just more direct communication lines. So it's kind of direct in two ways in my mind. Direct as far as direct in payment, and also direct in communication, interaction with your physician. Those are the two things that really make direct primary care direct. Okay, make sure I didn't miss anything there. I feel like it also eliminates a lot of distractions. So things that you may not know that your physician is thinking about in the back of their mind while they're seeing you in a visit, that they're worrying about, okay, am I putting this in here? Am I documenting that so that the insurance is gonna approve, accept, it will be justified to them for billing? We don't have to think about anymore because again, we've cut out that middleman of insurance. All right. Also, because this model is stripped down with less overhead, that means that there are less patients that a physician is having to care for. Most patients don't know how many patients their physician or provider is carrying as a whole. It kind of be fun if anyone's brave enough to throw out a number of how many physicians you think your physician is carrying. Might be good to see what people might think. But a lot of times that number is pretty shocking to patients. They don't realize how many other people their physician is caring for. But on average for family medicine physicians, that empanelment size is 2,500. There are some physicians who carry upwards to about 4,000. Direct primary care is usually much less, anywhere from 600 to 1,000, just depending on the needs of that patient empanelment. So fewer patients, as you can imagine, having to have less patients allows for better access again to your physician. So not only will appointment availability, be better, but we're able to have longer appointment times to be able to spend the time going through patient needs and making sure that concerns are addressed. Now, as you can imagine, some people might still have concerns that we could spend 2 hours on. might not be able to do that on a given day, but guess what? The likelihood that we're going to be able to get you back in quickly is much better than in a traditional insurance-driven model. Again, because we have fewer patients that we are carrying. Okay. And then, again, too, along with that, direct access for your urgent needs. So not only, are we going to have longer appointment times, better access to get you back if we need to, but just if you're calling for a same-day appointment, that's probably going to be better as well. All right, and then another thing, because this is set up, no insurance, this is set up as a membership model, right? That's how that is broken down with your primary care physician. So you pay a monthly membership fee to cover for those primary care services. So that's kind of the financials of it. There may be services that are additional costs outside of that monthly membership, but those are things that you are, again, gonna know about up front, and you're gonna pay for those at the time of service. So there's no waiting for an explanation of benefits, waiting for that final bill to come through to finally figure out what it is that you're going to pay for things. Because even if they try and give you, a fair estimate of what services are going to cost, there's so much diversity in insurance plans, even within an insurance group, so you could have Blue Cross, but your Blue Cross might be different than my Blue Cross, and therefore we're not paying the same. I know that there's even been family members come in for the exact same type of visit and really get two different types of bills. So we eliminate all of that with the monthly membership model, and then upfront pricing for any additional costs that may be incurred for other services. So those are usually going to be more specialty type treatments or procedures that just involve a little bit more expense as far as supplies, that sort of thing. And again, you're going to know those up front. So if you're like, ooh, this is not a good week, month, whatever for me to do that, then you can always know what that cost is going to be and schedule for a later date when you will be able to do that. A lot of people do kind of balk at the thought of paying additional, why should I pay this membership fee on top of insurance that I may already be paying? And that's a good question, but direct primary care memberships are really reasonable. So for pretty much the majority, if you break down their daily cost, that's going to average out to about the cost of a Starbucks coffee a day. So really that's something, that can be worked into a budget. I know it might not work for all people, but, if you look at things, that might be something that you can shift. Okay, so we kind of talked about how the membership fee works, and let's just talk a little bit about what's covered. So for most membership fees, that's going to include all of your wellness visits, so general well visits, well child, well women visits, sports physicals, routine chronic disease management, for your high blood pressure, your diabetes, your kidney disease, all of those things are going to be covered under the monthly membership. Also, any acute, urgent, same-day visits that are needed, those are going to be covered under your monthly membership model. And like we talked about, most minor basic procedures are going to be covered under that monthly membership fee. Again, if there's some that, just require a lot of supplies, there might be an additional charge for those, but you're going to know that cost up front. There are also times where the monthly membership fee covers in-house testing. So just like any other primary care clinic you go to, if you're doing a urine test for bladder infections, those swabs for flu, COVID, strep, sometimes those are covered under the membership model. Sometimes those are a little bit of an additional cost, and that just depends on how the clinic has kind of set up their membership model and taken into account being able to cover the cost of doing those tests. All right, so that's kind of what's covered under that monthly membership model. And then let's just talk about some drawbacks, because, there's always a pro and a con to everything, right? So even as great as I think direct primary care is, there can be some drawbacks for certain people. So some things, that people would consider a drawback is you can't use your insurance for primary care services. So financially, that just really might not be feasible. I mentioned earlier, it comes out to about a Starbucks coffee a day, but for some people, that's just not in the budget. I often do tell people it might mean you need to look at your insurance that you're paying for and perhaps adjust that so that then having the monthly membership makes more sense. I also would just kind of throw on a little caveat of thinking about direct primary care, the accessibility, in light of, if you have a time where you can't get into your primary care clinic and then you end up having to go to an urgent care or the emergency department because you couldn't get in for a somewhat urgent, maybe but simple issue, that didn't necessarily maybe require the emergency department, but it was the weekend, the urgent cares weren't open or whatever. You might think about that cost that you would incur for going to the urgent care and how much that adds to your overall health costs. So, in direct primary care, the goal is, let's be able to see you same day or next day for these flare-ups of chronic conditions before they get out of control, and avoid, having patients go to urgent care or emergency services if we can avoid it at all possible. So that's just something, a little caveat to that drawback to think about. The other thing, that might be a drawback for people is, again, that monthly membership fee. And they say, well, I'm very healthy. I only go to the doctor 1 or 2 times a year. I could see that. I could understand that. So paying a monthly membership model, might not make sense for you at that point in your life. But again, it just kind of depends on priorities, preferences, and where folks are at in stage of life. The other drawback for direct primary care, earlier I mentioned that it really doesn't matter what insurance you have because we don't take insurance. A direct primary care physician can see you. There's no worry about in-network, not in-network, participating, not participating, all of those sorts of words that insurance can use. The only real hiccup that we run into is with HMO type insurances. Because of the HMO's model, they do require an in-network physician, so a participating in-network physician to be able to do referrals and sometimes even doing ordering of tests, labs, radiology, that sort of thing. So that is a time where it really becomes difficult to work with a direct primary care clinic, because then you might have a direct primary care physician and then you're having to go see your HMO's approved provider physician to have these tests placed, and that can really get confusing for both physicians, as far as who's doing what, managing what, etc. So if you have an HMO, it's probably not ideal to join a direct primary care clinic. It's probably just better to see one of your HMO in-network providers, physicians, until you're able to get switched over into something else. The other thing, with direct primary care is a lot of times these are solo practice or kind of micro practices, so we talked about really eliminating administration and overhead. So they are, pretty stripped down. So if you're used to calling and getting a phone clerk or, somebody when you call, you might find yourself leaving messages or needing to utilize a patient portal to send messages, just to kind of start that communication with your physician. I will caveat this drawback as well in saying that even if you are having to leave a message for your physician, the likelihood that you're going to get a quicker direct response back is probably more likely in direct primary care than with the insurance-driven model. Because if you think about when you call to leave a message at your very busy primary care clinic, you're leaving that message, it's going back to the triage nurse. They're maybe contacting you to get some clarifying questions, then they're sending the message on to the doctor. And then when the doctor has time, they're responding back. Maybe they have some other follow-up questions, and there's a lot of back and forth. So a lot of that gets eliminated. So even if you leave a message and you're waiting a little while to hear back because they're busy in clinic or they were out of the clinic for that day, you're gonna get a response more directly from your physician back sooner. There also is a lot of kind of pushing for independence and utilization of tech in direct primary care. And sometimes that can be a struggle if folks aren't very tech savvy. Of course, you know, any direct primary care clinic or physician is going to be willing to help you navigate those things. Or if you really do just need to call to get an appointment scheduled because you can't figure out the online scheduling, that's something that, you know, we can help you with and do that. Okay. Other common questions that I've gotten, the biggest one is about HSA or those like health savings plans that folks may have as part of their insurance, you know, and using that for the membership fee or for other, you know, maybe additional costs that would come. So if there's a procedure that you're doing or specialty service that you're doing in the direct primary care clinic, can I use my HSA card to pay for that? So this is kind of a debated topic, and it's because there's many layers to this, right? So there's kind of the insurance policy as far as what that HSA can be used for, and then because it is, you know, non-taxable monies, the IRS gets involved as well. So currently for the state of Indiana, Indiana has said that direct primary care is not health insurance. So for most folks, their HSA is going to say, you can't use this to pay for health insurance. So that gives us a freedom there. But there is still that IRS component. So I usually recommend, you know, just double check with the health savings plan kind of covered benefit statement. And then also checking with your tax person or CPA to see what they would advise you on in using your HSA card for membership or any other ancillary fees that come up in the direct primary care clinic. Okay, the other question also surrounds money, and that is reimbursement. Can I submit to my insurance for reimbursement? So that probably does depend on your insurance. So again, checking with them to see what their policies are. I would say for the membership, that's probably something that pretty much all insurances are not going to give you reimbursement for. And because when you're submitting for reimbursement, they're looking for office visit codes, billing codes to sort of link if they're going to reimburse that or not. And when you're paying for that monthly membership, you're kind of paying for a hodgepodge of whatever may come up, and there's not necessarily a specific thing that the insurance company can latch onto and say, okay, we see this as a reimbursable charge or fee. Now, if you're having other ancillary services, so say you're having a mole excised, it's a fairly extensive, you know, removal of that mole, and so there's a little bit of an extra charge. That's something that we can say, okay, we can put, you know, procedure codes and billing codes with that the insurance is going to understand, and we can give you, you know, that kind of bill that has those on it, the receipt that you paid for it, and that's something that you could potentially submit to your insurance for reimbursement, because that's going to make sense in their billing mind. So I know those can kind of be some complicated situations and scenarios because insurance is so complex. So that's something you can always just kind of clarify. And if you think you would want to go through the efforts to submit for reimbursement, just make sure, you know, that you're asking or letting your physician know that you're wanting those things so that they can make sure the right codes and whatnot are in there to speak that insurance billing language. But you may honestly find that the hassle of trying to get reimbursed from the insurance is not worth it because you're not being charged that much more. And if you had gone to your clinic and used your insurance, you probably would have paid more as your out-of-pocket responsible cost for that procedure. So that's also just something to keep in mind. You know, is it really that expensive? how much would I have paid for it just out of pocket if I had gone and used my insurance. You might really just be breaking even or coming out ahead. And then the other thing people ask, is because direct primary care, we're not using insurance for primary care services, is can I use my insurance for other things? The answer is 100% yes. We definitely want folks to have insurance. Direct primary care is not health insurance. It does not cover you if you have need for emergency services, hospital stays, surgeries, those sorts of things. You're just covering your day-to-day routine health maintenance primary care services. So if we are, ordering tests and radiology studies, lab studies, cardiac testing, any of those sorts of things, your insurance can always be used for that. So your direct primary care may keep your insurance on file so that they can send those along with referrals. When they're ordering tests, they can send that information along to those places so that that can then be processed with the test that's being ordered, etc. So that kind of covers that, way you can use insurance. I will say with things like medications, labs, radiology, the goal of direct primary care is to try and keep insurance out of things if possible. So we will try and look for cash-based options that won't require us to jump through the hoops of prior authorization and all of those sorts of things. And there are definitely times, depending on a patient's insurance plan, that doing a cash pay option is going to be the same or possibly cheaper than trying to use your insurance for that. And that really holds out with folks that are on a higher deductible plan. So that might just depend on your plan. So kind of, educating yourself, becoming more aware of your plan, what's covered, making sure you know what your deductible is, what your responsible percentage is before and after that deductible is met, and really just empowering yourself with that information can kind of help decide how you're going to use your insurance smarter, and really just go for those cash-based options when it makes more sense to do so. Okay, I think we got through it all. You all must have been either just really soaking it in and I did great, or I totally confused you because I don't see any questions down there. But like I said, don't worry, the live will be, on the feed. So if you have questions later, feel free to come back to it. Drop those questions in, let me know, and I'll do my best to get those answered. If I don't know, like I said, I will look it up and try and find the best answer. There are a lot of good resources out there that very smart physicians have put together for direct primary care. So there's ways to get the answers to your question if I don't know it myself. Okay, and then I will be, like I said, this was really not about me and what I'm doing today. It was just about direct primary care in general, but information is coming over the weekend, so keep your eyes peeled for additional information about my clinic specifically. But I just wanted to lay the foundation about direct primary care, get you thinking about that, and hopefully answer any questions that you had, just to make this transition a little bit more smooth for those that are perhaps wanting to switch to direct primary care from their traditional insurance primary care clinic. So I wish you all a happy Friday. I look forward to hearing from you, and we'll talk soon.